Let me just say right at the top how grateful I am to stand on the Senate floor again with Senator Chuck Grassley. He has been one of the great partners I've had in my short time in the Senate, and I'm honored to have gotten a lot of good work done and good law passed. I want to thank him and his entire staff. They were all tremendous to work with and went above and beyond for us to get this done at a very quick pace. I want to thank our colleagues for acting with the urgency that this issue demands, and I am excited that this bill was able to pass that will ensure the families of first responders who lose their lives to the coronavirus are taken care of under the Public Safety Officers Benefit Program. We expect now that over 100 of these death benefit claims can be submitted to the Department of Justice in the coming days and weeks, and we cannot leave these grieving families to fight alone for the benefit that they need and deserve. As Senator Grassley very pointedly put it, we hope that the House of Representatives will pick up this legislation for immediate consideration. While COVID-19 has changed the daily life across this country for so many of us, I'm grateful that my colleague and so many of my colleagues understand that our firefighters, our EMTs, our police officers, and other emergency service personnel continue to put their lives on the line to protect our communities. And they've done so at significant and increased risk to themselves and their families. In hard-hit areas across our nation, we see first responders stepping up to enormous risk. Being a first responder during this pandemic is not a job. It is an all-consuming mission and, unfortunately, a tremendous sacrifice. It is responding to a call knowing that just by stepping inside someone's home, you are running a high risk of exposing yourself to the virus. It is wondering whether your personal protective gear or PPE that you have on is enough. It is, in many cases, wondering whether your PPE is even real, with so many of our first responders, unfortunately, using whatever they can scrounge up. If it is a means of buying foreign masks not designed for use in the United States or buying them from unknown vendors, they are doing what they can to protect themselves as they go about their urgent message. When they remove their PPE, it's the concern that your gloves or your goggles or your gowns, as you take them off piece by piece, straining to remember what you've touched, washing your hands repeatedly, but knowing and wondering and worrying if it's enough. It's performing life-saving procedures like CPR that may aerosolize the virus, hoping that your PPE that you're wearing is enough to protect you. These are the daily, hourly, moment-by-moment concerns that our first responders have. Senator Grassley's worked with first responders in so many ways, and he knows the challenges that this time brings about, from having to meticulously clean every surface of an ambulance, having to clean your squad houses, your police stations, knowing that the virus could be lingering there. It's going home and undressing in the basement or garage or even outside of your home, heading straight in the house for a shower, but still worrying, is it enough to protect your family? And we know that many of these first responders actually aren't going home to their family. They're separating themselves for periods of times because they live in fear of spreading the disease to a spouse, to a child, to a parent. And the emotional stress and strain of responding to a call, doing everything you can to save someone from this virus. But we know our first responders are often seeing death at a rate and a level in areas of our country they've never experienced before. This all adds to fear. This all adds to the anxiety, worry about their families, worry about their communities. Our first responders are doing what very few of us will ever have to do. They put their lives, their health, and often the health of their families on the line to protect their communities. They have always done it. But now in the time of coronavirus, their sacrifices are intensified. the very least we can do is to ensure that they don't have to worry about what will happen to their loved ones if something should happen to them. The Public Safety Officers Benefit Program that Senator Grassley mentioned was created to provide death and disability benefits to families of law enforcement officers, firefighters, EMS, and other first responders who are killed in the line of duty. Their benefits come in the form of financial support as well as educational scholarships for surviving spouses and children. And as Senator Grassley said, it cannot replace the life that's lost, but it is something that could give comfort to those families and to even the first responders who themselves are putting themselves in grave danger. Now, infectious diseases are currently covered under the program. An officer's family or department is required to provide evidence, though, that the disease they contracted while on duty. Providing that evidence can be straightforward. For instance, demonstrating that the first responder came in contact with a dirty needle, for example, and was then infected by something that caused them death. But the problem with COVID-19 is that it presents an entirely different challenge. While the Department of Justice works to make sure that families of those killed by COVID are covered, we must eliminate the instances in which families are asked to prove what is unprovable. To prove that somehow they caught this while they were in the hours of their duty. This is why our bill makes urgently needed changes to the PSOB program to reflect the unique threat that COVID-19 poses to first responders putting their lives on the line in this crisis. Many first responders have already made the ultimate sacrifice. I'm so grateful that Senator Grassley mentioned that. In New Jersey alone, 29 first responders have lost their lives to coronavirus just in the past 7 weeks, and we know this crisis is ongoing in our country. The bill that Chuck Grassley and I and our teams wrote creates a presumption that if a first responder contracts COVID-19 during this pandemic and tragically dies, their death will be treated as a line of duty death without the need to affirmatively prove their illness was contracted while on the job. When passed by the House and signed by the President, this presumption would be retroactive to January 1st, 2020, and will last until the end of 2021. The bill ensures that the families of first responders have the support they need and deserve when they face unimaginable loss. 27 years ago, New Jerseyan John Caricia watched as 2 EMTs saved his son's life. That same year, he became a volunteer EMT so he could pay it forward. Since then, he's worked as an EMT and served as the chief and training director of the Woodbridge Township Ambulance and Rescue Squad in Woodbridge, New Jersey. John passed away on April 17th after contracting COVID-19. John is survived by his children, Tony, Roseanne, and John, and 10 grandchildren. John's loved ones shared in his obituary this quote: "He will be remembered for his contagious laugh, his big heart greeting you with, 'Hey, guy.' He loved to spend time with his family and always had a story to tell. His favorite place to eat was the Rio Diner. He always chose to bring a chocolate cream pie for his dessert contribution and to any family gathering. His family asked, in lieu of flowers being sent, quote, 'John would hope that you will perform an unexpected act of kindness for someone in his name.'" Charles Rob Roberts joined the Glen Ridge, New Jersey Police Department in 2000. He lived in Glen Ridge, and his wife, Alice, two of them raised their children, Shay and Natalie and Gavin, right there in Glen Ridge. Officer Roberts contracted COVID-19 in the line of duty in April and was rushed to Mountainside Medical Center after being resuscitated in his home by his fellow officers and members of the volunteer ambulance squad on May 11th. Officer Roberts passed away at the age of 45. Last week, hundreds of residents of his town of Glen Ridge stood on their front lawns and sidewalks to pay tribute to Officer Roberts' life, his service, his love of community and family. In the New York Times article published after his passing, many of Officer Roberts' colleagues and neighbors shared stories about his kindness, his calm demeanor in the face of challenges. I quote from that: "There was the couple who remembered how calm he was when he helped deliver their baby in their kitchen. There was the older woman, forever grateful for the gentle way he held her hand when she broke her hip and they waited for an ambulance. And there was the father who struggled with a difficult son and remembered how Roberts looked him in the eye and reassured him that his boy was a good kid." Officer Roberts' father shared at his memorial that he, quote, "wanted to make others happy." Izzy Tolentino served in the U.S. Marine Corps before becoming a volunteer EMT and then a firefighter for the city of Passaic, New Jersey. Izzy contracted COVID-19 in the line of duty, and on March 31st, passed away at the age of 33. The first New Jersey firefighter to be killed by the virus. Israel is survived by his wife, Maria, and their two children, daughter, Aliana, age 9, who Izzy called his princess, and his son, Israel, age 7, who he called his best friend. I would like to share a few words from the NewJersey.com article published in the wake of Izzy's passing. I quote, "Israel Tolentino was born to be a firefighter. It wasn't out of love of the uniform, though Tolentino beamed with pride every day he walked out wearing the Passaic Fire Department emblem. It wasn't even out of a mountain of bravery or a penchant for running towards the flames. It was his wife, Maria Vasquez, who said because he couldn't help but be selfless. She said, it fulfilled his urge to serve others, said Vasquez, wife of more than 10 years. He was so selfless, it drew me closer to him. It drew everyone closer to him." These are among the 29 heroes just from New Jersey. Mr. President, Madam President, there are countless more first responders across the country who've lost their lives in responding to this crisis. Some of their names we know, and some we'll learn in the weeks and months to come. What we do know is that we owe it as a nation to their families, to their departments, to be there for those families, to be there for those children. Their families and the families of all first responders across the country who've lost loved ones to this virus deserve to be taken care of. For their sake, I hope the House of Representatives will act quickly to pass this legislation and that the President will sign it into law. Our first responders in this unprecedented global pandemic, they did not hesitate or equivocate. They did their duty. They stood up. They faced danger. They answered the call. And we now must answer the call. We must have their backs just as they had ours. Madam President, I yield the floor. Thank you.